Hi you guys, it's Barbara. I've created a short tutorial for you to assist you in this week's lab exercise. The objective of this is to learn how to put your parameter kit together so that you can accurately measure a vital capacity on any of your neuromuscular patients. Step 1. Obtain a parameter kit from your department. All the pieces within a parameter kit are shown in this picture. You won't need them all, but they will all come in the kit. Step 2. Obtain a pair of nose clips. This will either be found in the department or you can secure them from the Respiratory Therapy Pulmonary Function Lab. Step 3. Obtain a second 50 cc section of tubing and a mouthpiece. Both of these pieces should be found in the department as well. And then the final step, you're going to want to practice putting the kit together, and so that you are putting it together quickly and confidently before you go into your patient's room. Please watch the short video on how to put this together. Okay, so what I'm going to do here is I've gathered what I need to put together a parameter kit. Now, if you're doing this for a vital capacity at the bedside for your neuromuscular patients, you're going to need to set this up so that there's a mouthpiece on it. If you're doing this for parameters, you won't need the mouthpiece because the ET adapter or the ET tube will fit right onto your kit. You're going to grab this from the equipment room. So I'm going to open that right now. And I'm going to take everything out. And I'm going to get rid of this. And I'm not going to use this piece, and I'm not going to use this piece. I'm going to grab this. These are my two one-way valves. I'm going to close the ports first. And here is my patient connection. So I'm going to figure out which side goes to my right respirometer. The way I do that is I look at both sides of the one-way valves, and the one I can stick my finger in, that's my NIF, or my negative inspiratory force. My right respirometer is going to go on the opposite side. You can see that the one-way valve is flush with the side of the piece of equipment here. So I'm going to stick a 50 cc tubing here, and then my right respirometer is going to go on the end of that. Ashlyn, can you hand me just a 50 cc piece? If you need to take vital capacities, you're going to need a mouthpiece. Otherwise, if this is a RISB, your ET tube will go right here. If it's an intact airway and you're getting a vital capacity, go ahead and put a second 50 cc piece of tubing here, and the mouthpiece from an incentive spirometer will slide right onto that. If you don't happen to have that, maybe you have different kinds of mouthpieces, your 22 millimeter adapter that's in your parameter kit will go right here. Can you hand me the mouthpiece? Perfect. So if there are different kinds of mouthpieces, that will slide right over a 22 millimeter adapter, or just look for the patient's incentive spirometer and grab the mouthpiece there. And now you want to make sure that your right respirometer is on, and that it is properly zeroed before you begin your directions.